Yes, I'm a social worker by profession. I was a social worker for about 14 years, mainly working in the health sector and women's health. And I got interested in supervision when I became a trainer and did consultant training when my daughter was little.
Okay, great. Can you tell us a little bit about what you've been doing recently?
Well, I work for the University of Auckland and I teach supervision. We have an interprofessional supervision postgraduate program, which is really enjoyable. We teach a range of professions from really all the health and social service professions, and they're all busy practitioners and they come in and we teach block courses to help them to be really great supervisors. I'm also involved in research and supervision on an ongoing basis, and I have a project at the moment which is an international project attempting to find out what the most important issues are that need to be researched in supervision. I think because my background in social work and working in health, working in multidisciplinary teams in hospitals and clinical services, means that I really recognise the pressure that people are under, the pressure to perform, the pressure to deliver services, people's commitment to the patients and service users that they work with. And supervision for me is a little way of trying to redress the balance for professionals by giving them some time to focus on their skills, their professional development and the challenges that they face.
Pressure.
I think we're all under pressure in the era of austerity and cuts, and many people in health and social services are bearing the brunt of some quite considerable cuts and changes in the way their work is organised, and that's true around the world. That creates a lot of pressure. It creates pressure for people to deliver the best quality service under quite trying conditions. We feel that it's really important for social workers, counsellors, health workers to make sure that they balance their work and their other parts of their life, that they get support, that they put limits on the amount of work they take on when it's over a reasonable workload, and that they take time to refresh themselves. And that means having time to reflect on their work, but also to get professional development. And supervision can create that space where people can focus on their own careers and their own development.
Sure.
I think the main thing is to keep focused on the person in front of you, the person who you're delivering a service to, and to do the best you can, even though you know you've got a queue of calls to answer, there may be other people you have to see, but to do the best that you can with the time that you've got, and to get advice, to get support, to not take everything on your own shoulders. We strongly recommend that people work to develop good peer supports in their organisations, and for everyone working in health and social care to actually think about how to support their colleagues, particularly newly qualified colleagues, and to ensure that they can remain positive and hopeful and doing the best they can. We wrote the chapter in this book on difficult conversations because it's one of those topics that comes up quite often with professionals, particularly new professionals, who suddenly face the realities of professional life, where sometimes you have to have incredibly difficult conversations about things that people feel sensitive about, that maybe you're worried that you might engender some conflict. Sometimes those conversations are with colleagues, maybe people in other organisations that you have to relate to as a professional, or they may be difficult conversations with service users and their family members. So we wrote the chapter to help supervisors develop a way of preparing and planning and practicing sometimes the kinds of conversations that we have to have in professional practice that are more demanding than the everyday ones. We were delighted to have the opportunity to write the second book, because the first book, we've been really pleased with it. We know that people are enjoying it and using it, but like every project, when you're finished you think, oh, I wish we'd done this, or I wish we'd covered this, or people have said to us, why don't you write a chapter on this topic? Sometimes reviewers have said that we were surprised not to read anything about this topic. So in the second book we made a real effort to cover the kinds of areas that we didn't have time to deal with in the detail that we would have liked to in the first book. It's also given us the opportunity, in terms of some general ongoing issues, to update our material, to bring in new research that's been published and new scholarship. So we've been really delighted, and we think this book should be a good companion to the first book. It's not a rewrite, it has new content, and we feel that they work together as a companion pair for people perhaps beginning also to practice supervision.